Hi, good morning. My name is Christina and I am the Patient Experience Manager for our company. Before we get started, I wanted to ask a question that you can all answer by a show of hands. Have you ever planned to go out to dinner for a special occasion? Something that maybe you do a couple times a year. One of the first things that we do is we tend to ask around to our family and friends and begin to ask for recommendations. When a friend recommends a place, what's the first thing that you do? Well, after you look at the prices, we tend to go online and check reviews of that restaurant and see how the reviews kind of measure up to your friend's recommendation. If I go online and I look at the reviews and the restaurant is rated 2 stars with 85 reviews, I actually begin to question my friend's credibility and think, well, how much do they really even know about a restaurant? What most people don't realize is that this is exactly what the healthcare industry is shifting towards. Healthcare is shifting to a consumer-based industry. As more patients become insured, they now have the option of where they want to go for treatment. So let me ask you a question. If within 4 miles you have a 2-star hospital and within 5 miles you have a 5-star hospital, most people can agree that if they're able to drive that extra mile, they will and go to that 5-star hospital. So how can we improve our customer service to prevent our patients from driving that extra mile and coming to our facility where we can work towards becoming that 5-star hospital? One of the most common complaints that I receive from patients is not necessarily what is being said to them, but the way that the message is being delivered. Our process of the way nurses are required to communicate with patients does not personalize the experience in our facility. Currently, nurses answer questions with a yes or no type of response and really just go in, medicate the patient, change the patient, and answer basic questions. There is no ownership in making the patient's healthcare experience great. That is why I would like to use and implement the use of AIDIT within our facility. AIDIT stands for Acknowledge, Introduce, Duration, Explanation, and Thank you. I'm going to go through one scenario with 2 possible outcomes, and you can actually let me know which of the 2 you prefer. Both situations involve you being a patient lying down in a bed. You haven't seen your physician yet. People have been coming in and out of the rooms, but it's a lot of people and you're not really too sure who it is that's been coming in, and you're scared. You don't really know what's wrong with you. So, scenario number 1. Someone walks in, comes up to you, grabs your arm, draws some blood. Within 2 minutes, they cop everything up, they're ready to go, and they walk out. What does this do for you, and how does this make you feel? Many people would probably feel more confused and scared than they did before the employee walked in. Now, let's do the same scenario with a different outcome. Okay, someone walks in, knocks on the door. Hi, Mrs. Brown. My name is Christina and I am the lab technician. I'm going to draw blood so that we can run a few tests. The test should only take about 2 minutes, and then the doctor will be able to come in about 4 to 5 hours and then read and share the results with you. Fills up their vials, packs up. Thank you so much for choosing our facility, Mrs. Brown. The second scenario would most likely put you at ease, and that's just one employee. Imagine if all employees spoke to our patients within the same manner. Every employee that walked into your room acknowledged you, introduced themselves, told you what they were doing, explained why they were doing it, and then thanked you for coming to our facility. Our patients would feel comfortable and trusting of our facility and our employees, and not only recommend us to friends and family, but also leave great reviews on websites that individuals that may not have anyone to go to can look at and say, this is the place that's for me. It is really important for us to remember that that could be our mother, that could be our sister, that can be any of family members in that bed. And it's really important to think, how would you want your family, friend, or anyone that you know to be treated? And we need to do the same to the patients that come to our facility. Thank you.